Hey, how? Badakapi. Jahel Mancholo, Jahi Hakamato. My name is Darwin Fiddler from the Lakota Nation, Sanzar Kitazacho. I want to welcome you tonight. Well, welcome to the Turtle Island United web series on the prevention self care. Tonight's speakers will be Bernard Long, Chief Health Administrator, and Mark Harlow, MD and Chief Medical Officer for Oyate Health Center in Rapid City, South Dakota. They will be addressing the topic of how to stay healthy during the winter, as well as ways to prevent the spread of coronavirus. There will be a Q&A at the end of the presentation, so please hold your questions until then. Welcome, Bernie and Mark. I guess I want to start the first question. I wanted to, how is, the condition over there in South Dakota and Rapid City?
Our numbers continue to be high in terms of the positives, but I'm happy to report that the severity of the illness doesn't seem to be nearly what it was in the spring. And so although we do have patients that are being hospitalized, they seem to be fewer and the disease seems to be less acute than it was then. Once again, we have created, in effect, an intermediary facility. We, in the spring, used the travel lodge. We rented an entire building at a motel and put patients there who were COVID positive, but not really sick enough to be in the hospital, but not safe to go back to a home where there were a lot of folks that were potentially at higher risk. Now we've done the same thing with a motel called the Big Sky Lodge, which is on the east side of town and just up the hill from Regional Hospital, from Monument Hospital, should we need to take patients there. But in effect, it's a field hospital where we can place patients, monitor them twice daily with rounds, and keep them healthy until they've cleared the CDC protocols. So with the measures we have here in place at Oyate, we are testing roughly 100 people a day, with the intermediary facility trying to keep people isolated during their time of recovery. And with the cooperation that we have with Monument Health, we think we have things under reasonable control, as much as can be expected given the rampant community spread that we are in right now.
I was wondering if you guys could tell us more how to keep safe with the sanitation, the best way to do that and for the people there.
Sure. The best way to be safe is to follow the guidelines that we have all been taught since this came into our lives back in March. And those three important things are to wear a mask, to wash your hands frequently, and to practice social distancing. Although obviously we're not doing that right now because we couldn't figure out a way to get the camera working. But when we're in close proximity, we're careful not to speak in each other's direction or to wear our masks. For households, we discussed this earlier at some length, that we strongly recommend that if someone is COVID positive and is having significant symptoms, that they be kept separate from the other family members if possible. But we know that in a multi-generation home, that's not often possible. So the things that we can do to protect ourselves are to wear masks even in homes, and to practice hand hygiene, and to wipe down surfaces that are common surfaces, doorknobs, telephones, keyboards, faucet handles, refrigerator handle. When one is coughing or sneezing, cough into a Kleenex, and then use hand sanitizer after that. In fact, use hand sanitizer liberally throughout the course of your day to try to minimize the spread of the virus on surfaces. But we do know that this virus is principally transmitted through the air by coughing, sneezing, talking loudly, singing, shouting. And so wearing the mask is probably the most effective way to prevent that virus from becoming aerosolized and then floating around to get into other people's respiratory passages, which is where the virus then can get a foothold, continue to replicate, and create clinically significant illness. So those would be the most important things. Bernie, anything to add?
Well, one thing I know that's very hard on our population, the social distancing in the Native American population, we are so used to when we greet our relatives and loved ones, we always do give a hug, and it's very hard these days to not do that. And even professionally, we do the elbow bump, and you'll still see people. I've seen it on television over the weekend where they did the elbow bump and then still shook hands. You know, it's hard to break habits, and we just need to think very cognitively about this, be smart about our approach to this, and do so in a viewpoint that is not just protecting yourself, but you're protecting everybody else that you come in contact with, and your family and loved ones. So it's by making the difficult, challenging effort will be easier in the long run if your family stays safe.
Go ahead, Brian.
Well, I was just going to add a couple of things that some folks may not know. In our facility at Oyate, we have taken the effort to be clean and sanitized to a whole nother level during COVID. Early on, we were able to get an ionization fogging machine that puts a disinfectant out in all the rooms, so that if someone comes in potentially COVID positive, they're seen by a provider, a nurse being tested, and when that person is discharged, we bring in the housekeeping to do a complete clean up and use this ionizing device to make sure that the room is sterilized for the next patient that comes in. And so it's very important that everyone really look at trying to keep things as clean as possible.
And in that clinic, in that part of our building, we've established a separate area where we treat patients that are either COVID positive or suspected of being COVID positive. So we've been able to keep that subset of patients separate from others. For the patients that come in through urgent care, for backaches, for sprained ankles, for lacerations that need care, or those that are coming up to our regularly scheduled clinics for their routine visits. Those patients don't ever cross paths. They don't walk the same hallways. They don't use the same stairways or elevators. And so we can keep our contamination low on that basis as well. That's been very effective. Bernie and I put a policy in place in the first week in March, 2 weeks before the CDC recommended masking. And with that, we have had none of our employees contract COVID here at work. We have employees who have been COVID positive, but with contact tracing, we've been able to determine that they either got it at home from their spouse or from elsewhere in the community. So we are firm believers that masking is a key component of effective strategy to keep the virus at bay.
Can I ask, what are the warning signs? Say you're symptomatic and you're home. What would be the warning signs that it might be time to go to the hospital?
That's a great question, because when we first had COVID come into our lives, we really focused on 3 symptoms. It was cough, shortness of breath, and fever. And those were our benchmarks early on. And as time has gone on, that list of 3 has grown to a list of about 12. Now it's loss of taste and smell. It can be a sore throat. It can be gastrointestinal symptoms. It can be neurologic symptoms. So really anything that makes us feel out of our normal state of health could potentially be the signs of early COVID. So we encourage people to come in and be examined, be checked with a test if necessary. If they're having respiratory symptoms, we'll check their oxygen saturation, do a chest x-ray, and then treat them accordingly. But the list of symptoms grew from 3 to about 12. So anything that takes you out of your normal state of health and has you feeling ill, and this is especially true as we enter the time of our influenza peak, which is still roughly 2 months away. It's very difficult to distinguish the symptoms of influenza from the symptoms of COVID, or frankly, the symptoms of some of the other seasonal viral illnesses that we face every year. And so we're taking an aggressive posture to test everyone for COVID and influenza when they come in with any of the roughly dozens symptoms that we've just discussed. So we're quick to pull the trigger on testing to identify someone so they can keep their loved ones safe as possible and follow the recommendations for quarantining and isolating.
Dr. Harlow, earlier, I thought it was some important advice to talk about maybe the differences in disinfecting maybe dishes and utensils in a home versus surfaces, and maybe which cleaners would be most effective on the virus.
Sure. The virus is a particle of nucleic acid or genetic material surrounded by a protein and lipid coat. And so we know that simple soap and hot water is very effective in breaking down the coating on the virus, which makes it ineffective and non-infectious. So any household soap with good hot water is effective. We favor hand sanitizers and disinfecting wipes that have approximately 70% alcohol base. If we can get it to that level, that's great, but if not, even just, as I said, simple soap and water. Bleach is effective in killing the virus and bacteria, but I think there's been misinformation on bleach, and using it to wash dishes and other things is not recommended because there'll be residual bleach after you rinse your dishes and your glasses, and you don't want to be ingesting bleach. So I think simple household cleaners, but really attention to detail and being particular about wiping down the common surfaces that the family touches in the course of the day. Perhaps if you have children in the home, assign them the chore every day of getting the doorknobs, getting the keyboards, getting the faucets in the bathroom, and following those simple procedures, or just being diligent about keeping those surfaces clean. But any good hot soap and water is going to be very effective. So we don't need any specialized products to kill the viruses. And of course, antibacterial is different than antiviral, but they should be reasonably effective either way.
Is peroxide something that could be used?
Could be for surfaces. Certainly wouldn't put it on dishes and other things. There I think has been some information out where it's been recommended to gargle with it, and I don't know anybody who would recommend that. So I'm not a fan of that. That sounds too risky to me. It breaks down cells. The hydrogen peroxide causes cells to swell and burst, and that can't be healthy. But it is worth noting that there was a study out this weekend from one of the European countries that looked at mouthwashes, and knowing that the virus travels in our respiratory passages, and the nasopharynx is right next door to the oropharynx, that gargling it a couple of times a day with Listerine is a way to decrease the viral load and make it less likely that you would cough or sneeze it out and inadvertently transmit the virus to someone else.
This is one of those situations where every little thing could help then.
It really is.
Dr. Harlow, do you have any advice for young people living in big households, how they can stay safe and also protect their household members?
I think to engage them in the fight against the virus is the best way to get them to buy in, and give them daily chores and help them understand that this is to protect mother and dad, to protect grandmother and grandfather from the illness, and this is how they can help as a family member to keep everyone safe. Just to be responsible, to be disciplined, and to be diligent.
Thank you. We also have a question here in our chat from Thomas. He wants to know about oxygen saturation and the O2 finger readers, and when using those at home, and what would be the time to think about reaching out to a health provider or going to a hospital?
That's a very good question also. Just a quick lesson on how the virus works. We inhale the virus gets into our lungs. The virus attaches to one of the pneumocytes, or the cells in the lungs, and it fools the cell. It gets into the cell, and it makes the cell turn on the nucleus to create more copies of the virus. As the virus makes more copies, it eventually breaks out of the cell to go to other cells to do the same thing. But when it breaks out of the cell, it kills that cell, so that cell can't exchange oxygen and CO2 and help us breathe anymore. And that's how it is that we get short of breath. The larger the viral load, the more likelihood that we have of having large parts of our lungs affected by this. So when we can't exchange oxygen and carbon dioxide, we measure that with the pulse oximeter. That tells us what the concentration of oxygen in our bloodstream is. Normally, breathing room air, it's in the high 90s for most of us. If we get below 90, it's when we start to worry. Below 80, we really start to worry. There is a protein in the blood called hemoglobin, which carries oxygen. And there is a curve that we all learn in our medical training called the hemoglobin dissociation curve. And if it gets below a certain level, it falls very rapidly down to where the body doesn't have sufficient oxygen to keep us conscious or alive. And so we're very careful to not get out that far on the dissociation curve. So there isn't an exact number where if they're sitting at home with their pulse oximeter and they hit a certain number where I would say you need to get in to be seen right away. It's that plus how they're feeling. If they're feeling air hungry, if their respiratory rate is up and they're panting for breath and the pulse oximeter shows 82%, then that's a reason to go to the hospital promptly, because you might need oxygen support. You might need to get a chest x-ray to establish your current state of your lungs and whether you have what we call infiltrates that are concerning. So it's a combination of that number and how the patient is feeling, because if you're getting short of breath, air hungry, lightheaded, and the pulse oximeter gives you a lower number than what is customary for you, then it's time to go get medical care. The accuracy of the pulse oximeters is variable. The ones we send home with people are probably within 3 to 5% of what we would get on a medical grade one here in the healthcare facilities. So I wouldn't put a hard number on it. I would attach it to their symptoms. But I would be inclined to go more quickly to healthcare rather than wait too long. So I would encourage people, if they're feeling off their normal state of health, don't be hesitant or reluctant to go seek care from your providers. Better to be early than late.
This would be a good time to mention also that for folks in the younger population that may be concerned about their parents or their grandparents or aunts and uncles that may have some other underlying medical conditions, if they have a phone, pick up the phone and talk to them and see how they're feeling. If they're living alone or just not having access to other people to talk to, they may not take it as seriously and may not feel those symptoms. And reaching out to them and just asking, how are you feeling? How are you doing? You might be able to talk to them at the early stages of that and prevent them from getting into that where they're really compromised.
Agree.
How big of a part does nutrition play in all this, in what we eat, and what can we do as maybe preventative immune boosting to help us through this?
Yeah, very good question. I honestly don't have any recommendation regarding nutrition. As long as one eats a healthy diet, then I would recommend they continue that. There is growing evidence that supplementing your diet with vitamin D is a worthy consideration. When they looked at a number of the people who were severely afflicted with COVID-19, the majority of them were vitamin D deficient. So the presumption is that by adding vitamin D, that will be protective. Some of the other options are elderberry and such supplements that do boost the immune system, and I'm in favor of those. Zinc has been mentioned as an additive one might consider as well. And then we move on to the selenium and to hydroxychloroquine. Hydroxychloroquine was shown not to be effective when given to people that were in advanced illness, but there's anecdotal evidence that came out early and is still coming out that suggests if it's given early as a preventive measure, it can have good effect, but we won't know that for a while. And as you know, with what we've been reading about the vaccines, there is promise on the horizon, but it will be quite some time before we're sure that they are effective and that they will be distributed all across the world in sufficient quantity to create a significant dent in the spread of the virus. We're all very hopeful that will be true. It is worth noting that SARS from the early 2000s is a very close cousin to the COVID-19. And now, nearly 20 years on from the SARS epidemic, there still is no vaccine that's effective for that coronavirus. So we're hoping that with all of the resources that have been brought to bear in Project Warp Speed to develop a new vaccine, that one will be, or several will be very effective. With regard to other viral illnesses, for instance, AIDS first came on the scene in 1986. And the reason I know that is because I was an intern in Milwaukee, Wisconsin, and had the first patient in Milwaukee that ultimately turned out to have that disease as we defined what it was. And here we are all these years later, 34 years later, we still don't have a vaccine for AIDS, but we do have treatment for AIDS. There have been antiviral cocktails that have been developed which can eradicate the disease. So I'm expecting that in the future, we will be attacking COVID-19 with a combination of vaccinations and therapeutics to include the antivirals. So we will see how this evolves. There probably have been more resources brought to bear to treat this pandemic than have ever been used against any other disease in the history of mankind. So all the brightest scientific and medical minds have worked together to try to address this. So I'm optimistic that we will do very well as the months go by.
Thank you for the reassuring news. We have one more question from Jack, and Jack is asking, how long does exposure take, and can you get it walking past people eating at curbside dining without masks?
Potentially, yes, because there is growing evidence that aerosolization of the virus is how it can be transmitted, not just the droplets. When we're speaking, singing, yelling, droplets come out, and the droplets, because of gravity, drop down approximately 6 feet away from us, and the person across the table from us does not breathe them in, or they don't enter the mouth to find their way into our respiratory passages. But think of being in a parking lot and there is someone 50 feet away smoking a cigarette, and you can smell their cigarette smoke. That's aerosolization of those particles. So it's believed that viruses can travel on the air currents the same way that smoke would do, in which case, yes, you could potentially get a virus that's been aerosolized from a distance away from curbside dining or any other walk in the woods. So it just emphasizes the point that we should control that which is within our control. And by that, I mean we should wear masks when we're around others, because the virus doesn't know whether it's coming or going. It protects in both directions. So if I have it, I won't pass it to you, and I won't inhale it from you if you're a carrier. So I'm a firm advocate for masking, and have been since, as I said, 2 weeks before the CDC said we should do it. We were doing it here for our clinical and our non-clinical staff. And I'm confident in telling you that that has been why we've been so effective in keeping the disease out of our facility.
Not just masks, but even in not working here, but out in the public and everywhere else. If you don't have access to masks, and I think with the help that that you're all doing, you're encouraging that as well, and getting access to masks and face coverings. So there's evidence that face covering, even if all you have is a scarf to pull up at a time, there's benefit to that. Anything that you can use, but we're recommending good surgical masks, and in the facility we use N95s.
Mm-hmm. For patient contact, if you are treating a patient directly who is suspected of being positive or is positive, then we wear full PPE. We wear N95 mask, we wear a face shield and gown and gloves, so as to protect our workforce. That was really our first priority when this all started. Was we didn't want to build a warehouse full of protective equipment and have all of our workforce homesick. So we used it very liberally from early on. When that first surge came in the spring, we had all of our providers, all of our nurses, all of our staff that were in contact with patients. Even if it was someone coming in for a sprained ankle, we were in full PPE so that we could protect our workforce. We're only as good as the people who work with us here, so we have a strong priority to keep them safe and healthy.
And
I
what
just
about,
read earlier today, the Mayo Clinic had 900 of their employees test positive this weekend. So here's one of the premier medical institutions in the world, and I'm sure they're implementing every precaution that we are. And holy cow, 900 positives in their workforce. That's going to change their way of doing things for a while. It's a lot of people home that won't be there to care for patients. So again, if we're not here to care for patients, then what's next? So we very strongly emphasize keeping our people as healthy as possible.
how often should someone, I mean, the general public, I mean, we all have cloth masks, you know, what should be the general guideline with the cleaning and or reuse? It's hard to clean them every day, but is that what we should do, is have a new one every single day, or what should we do?
I think that when they start to get threadbare, you'll know it. I've worn this mask since I believe 2 Mondays ago. And when this one is done, I will throw it away probably end of this week. So this is another one where there's not a hard and fast rule on it. But with the face coverings that aren't as protective as a surgical mask, I would say throwing them in the washer every other day would be a good thing to do. Their filtration capacity is considerably less than our 3-ply surgical masks. And these are roughly 90% effective, as opposed to an N95, which is 95% effective. These are much more comfortable to wear all day. N95s we, again, wear when we're in direct patient contact, but when we're at our workstations or in meetings, then we stick with the surgical masks because 90% is very good. The N95s that seal tightly on all of their borders don't allow us to exhale our carbon dioxide, and over 80% of the nurses who were wearing N95s in the spring reported headaches in the course of their working day. So we let them switch from the N95s to the surgical masks when they're not seeing a patient directly.
So if you've had COVID, do you still recommend mask wearing afterwards? Even if you have those antibodies? Okay.
I do.
Is it because, like, could we still, like, those that have had COVID, can we still pass it on to others? I mean, what, and
you probably won't pass it on to others because the research has shown that after 10 days, the virus has for the most part run its course as an infectious agent, assuming that your symptoms have resolved and you haven't had a fever for at least 1 day off of Tylenol or ibuprofen. But you can still test positive for many weeks after that 10-day period because the test will pick up viral debris and non-infectious viruses that are still in your nasal passages. So it's, from what we know from the CDC, it's unlikely that you will affect others. The reason I recommend that you still wear your mask is because the virus can mutate. And although you may have antibodies to the first virus that entered your nasopharynx, you may not have good immunity to the next iteration of that virus. And that's been reported in multiple countries across the world too, of reinfections, of people who had COVID-19, recovered, and now have it again. And as an aside, entering the flu season, if you look at the last 5 years of flu data for South Dakota, and I did send that to you, Jennifer, in an email so you could see that graph. In February, for the last 5 years, is when we spike with influenza. And if we're wearing our mask to protect us from COVID, I would argue that it's going to protect us from influenza as well. So it has a collateral benefit of reducing our risk for influenza, even though we're technically wearing it for COVID. So I recommend that everyone mask in all of the social situations that we've discussed. There is no downside to it. I really view it as a public health, a wise public policy and public health measure that we can all take, not really different than wearing seatbelts. We know that's good for health. We do it. It's not that intrusive. We're used to it. I'm a surgeon. I wore a mask every day for 25 years in the operating room. We get used to it, and the safety that it provides is worth the trade-off in my estimation.
Thank you.
You know, HIV came up earlier, and one of the things that came about from that, and also talking about Hep C, is universal blood precautions. And that is to treat all blood as potential to be a contaminant and to avoid that at all costs. We're almost in that. I've said this before here amongst friends, is that universal COVID precautions is what we've just talked about, the big three: wearing the masks, keeping our hands washed, and social distancing. Those are those precautions that we can all take and just universally protect ourselves and our loved ones.
We have a few more questions. I'm not sure if we'll have time to address all of them. If we don't, friends, please feel free to email us after. We'll put up information on the page. But Thomas is making a comment about milk and vitamin D. I'm not sure what the comment is. Thomas, if you want to turn your microphone on and just share with us what you meant.
Yeah, fellow doctors had stated that a good source of vitamin D would be a good immune booster to help fight the symptoms. And I was just making the point that even though milk has a high source of vitamin D, that it still should not be a source of vitamin D, as if they were saying you should use a supplement because the milk will cause extra phlegm that's not needed.
I agree. And I might not have spoken clearly, but it was vitamin D as in dog. Excuse me. Yeah, I'm sorry.
Pasteurized milk is fortified with vitamin D to replace the pasteurization.
Okay, I'm with you. Yes.
So
Yeah,
on this,
and the other thing to consider there is that in a lot of communities, the Native American communities, we have a lot of folks that won't be drinking a lot of milk for a couple of reasons, but one of them being lactose intolerance. And
Correct.
so that's where we
I'm
need to be
lactose
thinking
intolerant
about.
myself.
Yeah.
I want to ask you a quick question. With the rise of the snow and stuff like that, that will take the humidity out of the air. So that will help in some kind of preventive manners. How would you suggest people go about if they have too much moisture in their house and so forth, to place a humidifier, a dehumidifier, and where should they place a dehumidifier in the house at to get best circumstances?
I think your point is an excellent one, but I will tell you I'm hardly an expert on that topic. As a matter of common sense, I would say put it in the high traffic area where the most air gets circulated, so it has the best chance to take the humidity out of the air. But I believe you're probably more educated on that topic than I, so I won't pretend to know what I don't know.
I'm a child psychologist and rehabilitation specialist for Dr. Wise, so you have more knowledge on the COVID than I do. I was just referencing, some people may have benefits to having a dehumidifier, or would your professional opinion say that a dehumidifier will dry out the lungs too much and cause an irritation dry, and they should just go with the normal air? Or would you suggest that, it's a one-on-one basis for each individual, of course, but just for a general statement, would you believe that a dehumidifier would help, or would you think it would hinder and cause too much dry irritation?
I'm inclined to think that it would dry out one's nasal passages and one's pulmonary tree to the extent it's probably better not to do it. I'm not, in fact, in my home, I'm using a humidifier because of this time of year. I haven't changed my mind because this is the time of year that everything dries out in our house. So I'm using a humidifier.
Okay.
But I don't disagree with your point. So, but on an individual basis, people can decide, but I generally favor a little more moisture in the air during these cold months.
Okay, appreciate it.
on the question of vitamins, Annette is asking, what dosage of vitamin D3 and zinc do you recommend? And also, is there a particular blood type which seems to demonstrate some immunity to the virus?
Well, on vitamin D, 5,000 international units is what I'm taking every day, and that's probably twice the recommended dose. But the thing about vitamins is that your body will take as much as it can use, and the rest of it will come out in waste products. So when I have patients who are on high doses of vitamins, I tell them that what it really creates is expensive urine, because the body can only use so much. But with the vitamin D, I'm going with 5,000, and the zinc, whatever the recommended dose per day is, I would say double it, and with the same philosophy, is the body will take what it can use and what it needs, and the rest will go out. And I didn't hear the second part of your question.
The second question was about the blood type and if there are any specific blood types that demonstrate better immunity to the virus.
Some of the early studies were thinking that the blood type did have a bearing on it, but they've been refuted now. There's no evidence that type O is more at risk than type A, B, or AB. So there is work to be done. There's a lot, there's so much about this virus that we don't yet understand. And we have not been able to define the pathophysiology at this point because it is so new to us. That's why it's called the novel coronavirus, because it's new. There have been young people who have developed strokes, which is typically a disease of older folks. And because of the hypercoagulable state that occurs with this virus, people in their 20s are having strokes. Heart disease, the neurologic complications are becoming more prevalent and more evident. And so we have so much yet to learn about the virus. But from what I've read in the scientific papers, there is no provable connection between blood type and sensitivity to the coronavirus at this time.
What would your suggestion be to diabetics, being that they have a higher sugar concentrate in their body, and viruses and colds and stuff like that, like sugars, they would be more susceptible to COVID, or would you say not?
They are. And by virtue of their decreased immune system responses, because of the systemic involvement of diabetes and being a small vessel disease, it affects all of our end organs. And so diabetics should be particularly careful during this time of COVID to maintain their sugars in the therapeutic safe range, in the physiologic safe range, and to do all the things we've been discussing all along. Knowing that they are at greater risk means that they should be more inclined to take excessive precautions. Again, I always would recommend erring on the side of too much caution rather than too little. These are the things we can control, and I recommend we control that which is within our control, because so much of this is not within our control.
And so everybody, including those that have had any underlying medical conditions, they're always more at risk from inflammatory diseases to cardiac conditions, but everybody has some risk in this game right now with COVID. Very strong, healthy people have had some very negative outcomes from this, and even death. And those are the people that we thought that would survive this disease that we're dealing with, the pandemic. But it's proven to be a formidable adversary, as Dr. Harlow would point out. And so we have to really consider that the risk is there. And that moves us to a prevention role. And we all can take a good, strong point and a role in prevention, not just ourselves, but others in our families.
What about traveling? We've been hearing a lot about, travel restrictions and, having people over, and it's so confusing. Do you have any advice about a good way to manage that?
Well, I think social distancing is the key to whether or not that should take place. If you have a large home and there's room for everybody to sit 6 to 10 feet apart, and you can eat Thanksgiving meals in a shift so that you're not sitting on top of one another, I think that's fine. One of the biggest issues here as a side issue is the behavioral health consequences of what this virus has done to all people. And I'm sure Dr. Whitefeather knows this better than I do by far, is that the behavioral health issues that are brought to bear in the children who aren't socializing at school, who can't be with their friends. As adults, we can accept it. Kids, it's not as easy. And so if it can be done safely with distancing and the other precautions, and assuming that no one in the family has symptoms, I think it's a reasonable thing to gather as a family, as long as you're careful. But the other side of that discussion is that we know that there are people who are positive but have no symptoms. So wear your masks when you're around your family. Bump your elbows instead of embracing and shaking hands, or just wave from across the room and say, I can't wait until we can be together again, but right now it's better that we keep our distance. I have an almost 2-month-old grandson who I have yet to hold, who I have yet to hug. And because I don't ever want it on my conscience that he got sick and I was the cause of that. So as much as I'd love to snuggle with him and start to get acquainted with him, I am doing what is best for him. And I would guess we would all feel the same.
You kind of already answered it. I think Jack is asking if it's possible, as with HIV, to be non-infected and just be a carrier without any symptoms.
Absolutely. Yes. That's why when you ask the question, who should be tested, the ideal answer is everyone, every day. But that's not reasonable. But we don't know who's carrying, because there are a good number of people who are potentially infectious but have no symptoms to warn them or to warn others. And I'm sorry, I'm becoming a broken record here. That's why you wear your mask, because you don't know. You can't know.
Right, and if I may step in, and then with the autoimmune deficiency, it's stated just in its title that it's an autoimmune deficiency, which means you don't have that strong of an immune system. So to elaborate on what he said, that is, yes, you know, you could have the autoimmune deficiencies and be a carrier of COVID and not even know, because of the autoimmune deficiencies can mask the COVID process of your knowing your symptoms, because your body can't tell you that it needs an immune booster.
Yeah, the symptoms that we have are evidence of the disease. The reason we get a stuffy nose and a sore throat is because our immune system is responding to the invader into our bodies. So if your body can't respond, you will not know that you're carrying.
You know, there was a question earlier about our young ones and what they can do here, and what we have the ability to teach and install confidence. I know we talked about HIV earlier, and I remember being in Hot Springs when South Dakota was first introducing the HIV education, and the school board had to meet with the community, and they were all in an uproar about, we don't want to teach our grade schools anything about sex education or what have you. And so we had to go and listen to what the rollout plan was. And up to about the grades 6 was all about washing your hands before you eat, wash your hands after you go to the bathroom, respect others, keep yourself clean, even things like make your bed. It was installing some responsibility in our youth. This is a one time that we can take a positive out of this coronavirus and say this puts some responsibility to us to teach our children how to be responsible and how to learn to protect themselves and others. So we can take one positive thing from that and say our kids have to learn something different.
I do have a question. The health people through the Rapid City areas and all the reservations, are you guys getting influx into false numbers to, like you're saying, mental state, and just you know, because there are some relatives that are, you know, that passed on to the spirit world because of this, but also at that state in time, are they coming to you to get tested? And also, like, you know, are you guys, you know, where do you go? I mean, I don't know who's taking that. Are you guys taking that general sense of assembly of, you know, advocates for that in general, or, you know, because we don't know where we're going in Rapid City. I mean, just, you know.
We will see any Native American citizen who needs to be seen because they're symptomatic. We're open 7 days a week from 7 in the morning until 7 in the evening.
Okay.
And we're doing curbside testing Monday through Friday from 8 o'clock until 4 o'clock. previously we did curbside testing from 7 to 7, and the numbers we were seeing were overwhelming our staff, and we were over capacity. So we've scaled it back and asked that people call ahead so that we can control the workflow as well as we can. There's a new test out called the Binax test. It's a rapid read. It's a card, and it uses saliva rather than the Q-tip way up into the nose. And we're working on a program that we'll be doing over on the northeast side of Rapid City, open to all, and we will be able to turn those results around in about 15 minutes. So we're using the resources we have. For a while, we didn't have enough testing supplies to keep up with the number of people who wanted to be tested. But as the manufacturing process has improved, we're getting ample supplies. So we will be ramping up. And I heard on the radio this morning as I was driving in that the State Department of Health is going to be doing mass testing here in Rapid City, November 20th through the 23rd. So there should be ample opportunities for everyone and anyone that wants to get a baseline test to come and do so.
Y'all just stated that, this is a short, quick legal question. Y'all stated that you'll help any Native American citizen. So that means tribally enrolled. Are you stay in Rapid City, so that's basically the Great Sioux Nation. So y'all are not testing the Sioux tribe, tribal members that are not enrolled, or just the enrolled members?
All tribes. And in Navajo, anybody that comes in that is sick, feeling as if they may have contracted COVID or concerned that they have, we will see them and we will treat them.
Whether they're enrolled or not?
That gets over to whether or not we get paid for them or not. That's a whole different discussion. But when someone comes to us with a medical need, we will address their medical need, no questions asked.
Appreciate you, gentlemen.
We consider Oyate Health Program as a direct service, like a lot of the Indian Health Service. So enrollment would not necessarily be required of a Native American if they can show descendancy. So Correct. If they can show descendancy, they can get health care in our organization. The folks from Pine Ridge and Eagle Butte have accessed a lot of our health facilities here. I will tell you, I have a thing on my board up here that has numbers on it, talks about our user population, and it gets a little complicated when you come from an Indian Health Service background about the number of people that you serve. Is it a user population? Is it a active service base? But our computers would show us that when we were beginning to take over from the Indian Health Service, the population that was being served here in Pennington County was about 17,000.
Right.
When our computer system is asked now, how many people have asked us, and that means that someone has come and used our facility at least once in the last 3 years, that is now over 19,000. So we've picked up some new folks and added to our service line, and we continue to encourage them to use us for their health care as much as they would like to.
All right, and to answer your question about being paid as well, I stepped out of the medical field and got into the legal field and counsel for 122 tribes. So that's why I was asking about the enrollment process. But you already covered that descendancy, and that is true through the Federal Reorganization Act, is that if you can, not Reorganization Act, but Recognition Act, that if you can enroll but are not enrolled, then the same legal ramifications and protocols can be afforded to you. But yeah, you've already answered that.
So another thing that I'd like to add to the conversation before we start losing some time is that the Oyate Health Center is part of another organization called the Great Plains Tribal Leaders Health Board. And they have recently established what they call the EOC, an Emergency Operations Center. And kind of jokingly say that's our mothership, so to speak, but we take a lot of guidance from them, and they have a website that is available. It's just www, the initials of Great Plains Tribal Chairman's Health Board or Tribal Leaders Health Board.org. They have a lot of information for folks on there about COVID. A lot of it is just used from the CDC as guidance. It's what we use as our Bible as we're dealing with the pandemic. But one of the things I wanted to mention, we talked about the mental health. We're recently writing a grant to expand some behavioral health services to all of our community members as much as we can to expand our capacity. The EOC is also providing some nutrients, some meals, different types of supplies for folks here in this community that may be running short. And I think they probably are providing 20 to 30 meals a day for folks. Right now, I know we're going through some Christmas
Food boxes, Thanksgiving meals, all being provided free of charge to those who just need to ask for it. That's the only criterion. Just ask and we'll be happy to help as best we can. We also work closely with the Cornerstone Rescue Mission here in Rapid City, which is an organization that addresses homelessness. And we've worked with them on providing shelter for COVID positive, homeless Native Americans. And that's the Big Sky Lodge, the hotel where we've rented 30 rooms for 2 months so as to provide shelter during these cold times to those that need it.
So one of the great things about what we're doing these days, Dr. Harlow, from the days that this would have been left at Indian Health Service, we have much more latitude. We have the ability to serve our people at a different level, much more broader services, and that's comforting to know that we're able to do that for our Native communities in a better way that would have been offered if it was just Indian Health Service under the federal side.
I was just gonna say I appreciate everything because it seems like you guys really stepped up in this time of need for the people, and it's people like you guys that step up and make things happen for the health of the nations, because it's so bearing and to see that up front on the nations within the reservations health board. And I used to work in the hospital at IHS in Eagle Butte as a health representative, and see up front with all these different type of they seem to not to have that or just could not come up with some kind of plan or what have you. But what you guys are doing, I'm really appreciative that of this, and the knowledge and everything that you guys are doing for the community and the people. And it's really a big, like you say, broader. And I'm really, whatever I can do to help, feel free to let me know, because it's really good. Thank you.
Well, we appreciate the partnership, and that's one of the things that, like Dr. Harlow was mentioning, is that we're trying to find the difficult yes instead of the easy no, and we're trying to develop partnerships because we know we can't do it alone. You're hearing health professionals all across the state of South Dakota asking everybody to wear a mask because they're overwhelmed in Sioux Falls. And that just takes a lot of partnerships. The things that we're doing here tonight by sharing information and developing a relationship with each other and a partnership for better health. This is great stuff that you're doing.
Well, I want to thank you, Bernie and Mark, for all the great information and sharing the knowledge and expertise with us. We hope you enjoyed tonight's presentation. Our next webinar will be in 2 weeks on Wednesday, November 25th. Thank you for joining and have a blessed evening. And thank you guys so much.